Good afternoon. This is Tom Dermody, Mayor of the City of LaPorte. First, I want to say that I am taking off my mask, and Dr. Leonard from LaPorte Hospital is taking off his mask because we're each alone in our location, so we're not in contact with any individuals. But welcome, and we'll be getting the main course here with Dr. Leonard momentarily. But while I have everybody, welcome to our first AMA, Ask Me Anything in a while. And we thought this would be great timing with winter on its way, fastly approaching, and a lot of calls coming into City Hall, into the community about the concerns about COVID numbers coming up. We thought it'd be a great time to have a AMA Ask Me Anything. Before that, and please message during this if you have questions for Doc Leonard. But before we talk about that, just as a reminder, the dumpster program, while it's coming to a quick end, it's been moved over by the water department so it can be monitored by security channels. Just remember, please be respectful and don't leave trash on the ground or overfill the dumpster. It's a shame that I have to say that, or we have to say that to the community. We're trying to do a good thing and allow the public and residents to dump what's unnecessary at their home. Please be respectful. Also, we're having a live AMA next Wednesday evening at 6 p.m. to answer any questions about the water and wastewater infrastructure plan. Right now, we have $100 million worth of infrastructure work for our water and sewer, and I just can't kick the can down the road much further. We have systems, because we're an older community, that we have water and sewer infrastructure that has been put in before 1901. That is years old, and we have a water system that's the third oldest in our state, and we can turn our head and hope that we don't have issues where we're dealing with boil waters or the water system breaking, or deal with this for the residents. And it does come with an increase, but myself, Jerry Jackson, our water superintendent or wastewater superintendent, and Tim Warner, our water superintendent, will be live on Facebook at 6 p.m. But know this, any increase in dollars, the first year it's roughly 17 cents a day of an increase, are going into the ground so that we can repair and make sure the letter and number streets no longer flood in the street and back up into people's basement. Monroe Manor, for example, Southmore Avenue, all these areas that need to be done that we can't ignore, and we won't ignore any longer. So please keep that in mind next Wednesday at 6 p.m. Also, there's time, just as a reminder, to complete the census, 2020 census.gov. That helps all local communities and so forth. Halloween is fast approaching. We right now are still scheduled to have trick or treat from 5 p.m. to 7 p.m. on Halloween, but we encourage parents to take all necessary health and safety precautions. If you're uncomfortable, please don't participate. Don't turn your light on. Don't take your kids out. And we want everybody to be responsible. I think we'll have a little conversation with Dr. Leonard about that and safety with trick or treat, like many communities are having. Our goal with COVID and bringing Dr. Leonard on is to answer questions that will keep you safe and allow you to continue to go to work. No one wants to shut down this community. Nobody wants to shut down the state. We want to keep the economy going and keep everybody healthy together. So with that, I guess we can start with Dr. Leonard now. Dr. Jim Leonard, welcome back to AMA. You're one of the most popular guests we have, so I think the public's ready to see you and ready to chat with you.
Sounds great. Thanks, Mayor. Thanks for having me here again. So yeah, I'll just kick off. Well, obviously we're back here because our numbers are rising. It's very important that we continue to do maintaining all those precautions, adhering to all those precautions as much as possible, because our numbers are going up, and we just want to keep everybody safe and be able to support the hospital system to provide all the resources necessary to care for those folks who really need it when they need it. So I'll start with some numbers again, like we've done in the past. Overall, nationwide, 8.2 million cases now, 1,000 deaths. In the state of Indiana, we have approximately 152,000 cases with 3,790 deaths. Here in LaPorte County, we have over 2,200 total cases with 58 deaths. That there's an 8.5% 7-day positivity rate currently. And that means for every 100 people tested, 8 to 9 of those are coming up positive. That rate, that positivity rate, is the highest it's been for us here in our county. In Porter County, or neighboring counties, I'll go over those. We have 3,000 cases in Porter County, 48 deaths. They have an 80% 7-day positivity rate. That's also on the rise. St. Joe County, 9,000 cases, 161 deaths, 6% 7-day positivity rate. That's also an increase for them. Out in Lake County, 13,000 total cases with 352 deaths. That's a 9% positivity rate currently in the 7-day look back. Again, their highest rate also. So the positivity rates are the highest that they've ever been in our entire region. When you're looking at our neighboring surrounding counties, there's an uptick in hospitalizations seen in our region, region-wide. Not just our own hospital, but out in Porter County, our St. Anthony, Michigan City, those numbers are high also. Everywhere you look out in South Bend, the numbers are, they've never been higher regarding hospitalizations and patients in an ICU setting and so forth. So again, very important that we continue to be very vigilant on adhering to those precautions to stay safe. So that's the numbers for now. If you want to go over some questions, I'd be happy to do that.
And please, with the public that's watching, we're getting a nice turnout here. Please message a question. Doc's willing to answer anything after we go through some of our questions here. But before we do, Doc Leonard this is more than just your profession now, because again, I think it's fair to share with the public, you tested positive for COVID a while back and explained, and I would tell everybody, Doc's in good shape, he's young, I hope you don't mind that I still call you young, but you went through this personally, testing positive, and if you don't mind, share your experience with us.
Sure, I'd be happy to. So this thing's for real. I'm 49 years old, no medical conditions, healthy for my age. My story goes back, I caught it in and around Labor Day weekend. I had taken 1 week off to go do a medical seminar. So 7 days away from that. And then I returned from that. I took a week off from work just to stay here in town and go fishing and spend time with my kids and typical break. So I was actually out of the hospital system, hadn't set foot in any hospital for over 2 weeks. Then I started with just some basic low back pain. I thought it was from the work I was doing. I was working on the house the day prior. So I dismissed it. Very next day, I started with a very mild, non-productive cough. Otherwise, felt perfectly fine. And I was thinking, well, what's the cough from? Is it overkill to go and get a test? Nope. I gotta lead by example and be careful. So I told my wife and I stayed away from them and the kids. Made an appointment through the COVID line to get tested here in town. Next day, I went in for the test, got the turnaround within about a day, and I was notified that I was positive. So from that point on, just hunkered down, didn't go anywhere, kept my distance at home with the children, followed all the precautions that we should. And then it was about day 3, and I was thinking, this is a cough. Well, this is going to be my version of COVID. I'm young, relatively young and healthy for my age. I should be mild. But then on the 3rd or 4th day, I got a fever, 103, and it would cycle a few fevers per day. And from that point on, I went 10 straight days with fevers. Severe body aches, generalized weakness, cough, shortness of breath at night, terrible headaches, no appetite, unable to keep anything down. So as each day inched by, my condition just got worse and worse and worse. I had concern that I was going to have to be admitted because of the shortness of breath at night. Went in here to the ED to get checked out. Fortunately, my workup in the ER looked promising. I knew that I was stable and okay to go back home and continue to ride it out there. But again, it was a total of 10 days of riding through it. And after that much time of being that sick, you lose all your energy, you lose all your reserves. It took me an additional week after that to actually get back to a full state of recovery where it was appropriate and safe and, able to go back to work and just resume normal activities. So why me? I don't meet the risk factors. We talk about 65 years old, heart disease, diabetes, end-stage renal disease, immunocompromised state, COPD. Those folks are at the highest risk for having severe illness if they were to catch the COVID-19. So why me so bad? Don't have a good reason for that. But when you do a look back and you consider all those folks that can have severe forms of the illness, it isn't just those in the high risk area. There are plenty of individuals, in the 20 to 30-year-old range, 30 to 40, that can get just as sick as well. So just because you might not fit in the range of what is determined to be a high risk condition, it doesn't mean that you may just be an asymptomatic carrier, or you might have a mild version of the illness. It can hit you very hard. So again, I would just end by saying this thing is very real. It's extremely dangerous, and I'm just fortunate that it wasn't any worse. I would say, so how did I catch it? That was a big concern of mine. I'm thinking, I wasn't in the hospital. It was 14 days out. What happened? Well, I have 4 children. They were all going to school. They were doing things right as they should have. I would make essential trips only. I go to the grocery store. I took one trip to the hardware store to get that work on the house done. But everything in both stores was, appropriate. The way things were done was right. Kept my mask on, washed my hands before and after anything I touched. But I did very minimal as far as being out in the community and potentially getting exposed. I had my entire family tested, and all of them were negative. They all had a PCR test, which is the high sensitivity test, and my wife and all children, all 4 kids were negative. So where I got it from, I'm not certain. So it just goes to show that even if, we are doing what we should be doing, there's still risk that you can catch it. So again, I would just end with be extremely careful. The infection does spread. You can get it. And even if you're not in a high risk category, you still are at real risk to getting a severe infection. Nothing you want to go through. Trust me, I've had the flu years back. I've gone through pneumonia once, and I tell you, this is the hardest thing I've had to go through in my life. So glad it's over.
And we're grateful that you're healthy again and back here working. But again, to those that say it's fake, it's not real, and it's not that big a deal, this is much different from your personal experience than the flu.
Absolutely.
So let's talk about that. So as of right now, since last time we've had you on, are any of the symptoms, if people have symptoms, what are those symptoms now? Are they the same, more, less? What should people be looking out for? Yeah.
So again, trust your instincts, and just the slightest little cough that you can't explain, that could be it. That was my first symptom. Well, the low back pain was a piece of it too. So I'll start with this. The typical symptoms, and when you look at seeing patients in the emergency department and into the hospital, and you understand, you get to listen to they'll give you a history of their own symptoms. It does seem very common that the most likely or most common symptoms that you're going to get include what you always hear about: body aches and pains, fever. The fever doesn't have to be very high. A 100.4 or greater is the definition we typically use for fever. Body aches and pains, you just feel like you maybe overdid it, a little achy. That could be a real symptom there. Loss of taste and smell. Many folks, they'll say that that's their first symptom that they'll develop. Loss of taste and smell. For me, it was really when the fever hit that I just lost that during the whole course of the illness. So that's very real. Headaches. The cough is by far the most common symptom. It gets worse. Overnight, it can get worse. During the day, it can get worse. Shortness of breath is a very important symptom to pay attention to. So those are your typical symptoms that you see. Anything like that at all, if you're getting any of those symptoms, you have to think you may have it. Be very careful on where you go. Wash your hands, distance yourself, wear a mask in public, and go get tested so that you know, so you have a better idea. Is this from COVID-19 or is it from something else? Very important that you get tested. In children, it can be a little bit different. Some kids will say they got a sore throat. Some, it's a little bit of GI upset. So again, keep a broad mind and ask yourself for anything outside the normal for you. If anything is new, and concerning to you that you can't clearly explain and know that it's something from something else, err on the side of caution, be very careful with your behavior, and go be tested.
That's great stuff. And you mentioned masks, and I know there's been a lot of debate, and I'm not asking you to put yourself into the political side of things, but a mask, at worst case, wearing a mask does nothing, but you should at least wear it for everybody else. If you believe it doesn't do anything to protect you, you should at least wear a mask for everybody else's protection, correct?
Yeah, that's right. The mask is proven to prevent spread of your respiratory droplets from getting further away from you. There's lots of studies out there. There's some pretty neat ones on YouTube, or there's some experiments done. You can go there and take a look at those. It's incredible that the experiments done, and the neat ones to watch are little demonstrations where there's a fellow in his backyard using a surgical mask, and he does this demonstration. He can show you how far the respiratory droplets can go, and when you wear them versus when you're wearing a mask and not wearing a mask. It's incredible what this mask can do to prevent the spread of those respiratory droplets. So right, there's absolute science out there and proof that when you're wearing the mask, you are preventing your own respiratory secretions from reaching somebody else. So to not wear one, it's not to say that you have the right to not wear a mask, and it's up, you have the right to decide whether or not you're going to get sick or not. Really, what you're doing is you're preventing the spread to someone else. So you have my take on this is we all have a responsibility to not get somebody else sick. That's a big responsibility, and we got to think beyond just ourselves when we decide whether or not we're going to wear a mask. We're not wearing it for ourselves; we're wearing it for others. Right? Does it prevent spread to yourself? Now, really, N95s are the only masks that really we use as formal protection, and face shields over an N95 to prevent the virus from reaching yourself as a healthcare provider or someone that could be around those folks that are sick. But extremely important to keep those masks on. If there's anything, the most common form of spread is respiratory droplets. So in talking and sneezing and coughing, that's where we spread that. By far the most common source of spread. So masks they mean everything. Again, you can't transmit infection from if you've touched your mouth and you touch a surface and someone else touches that surface, you can spread it that way as well. So keeping your home clean, keeping the surfaces that you work around and are around clean, very important. After you've been to the grocery store or been somewhere, before you're about to handle any food or get your hands onto somebody else or into your own mouth, say if you're eating, wash your hands very, very well.
Well, and the other part is, again, from a mayoral perspective in a small community in the nation, there's no game to try to take away anybody's personal rights. We're dealing with a world pandemic, and all we're trying to say is, hey, we want everybody as much as possible to be safe. Wear your mask to help other people, whether you're going into the store. And that's also something else in the grocery store. We had a mandate early on that, hey, only one member of a family go into the store. But you're suggesting, especially I'll suggest that if you don't have to take all your family members into the grocery store for shopping, I know some things times are tough and you don't have babysitters or whatever, but there is delivery, there's Instacart, there's these groups that deliver. But if you do have to go to the store, try to single yourself out to be the only one to go. Would you agree with that, Doc?
Yeah, keep it limited. Again, just immense amount of common sense and just be smart. Thinking that anytime that you go into the community, you have a chance of catching it. And then so if you're bringing multiple family members, you're just increasing your chances that someone in your family is going to catch it. Then you're going to bring it back into the household, and then it's going to spread throughout the household. So, yeah, minimize traveling in groups, minimize gathering in groups. Where you are gathering in groups, be safe, be careful, follow the state's directives on all of that. We just adhere to these practices that are already out there and these recommendations and things coming from both from the mayor here in town and those things for the state. If you stick to those precautions, you should be okay.
So as we talk about that, I mentioned trick or treat earlier. You might yell at me for that, but right now we're still planning on trick or treat on Halloween from 5 to 7. Any suggestions there? First of all, I would like to say anybody that doesn't feel comfortable, please don't participate. Don't turn on your light. Don't go out. But Doc, is there anything else that you might want to add to that for those 2 hours?
Yeah, there's some good ideas on the CDC website on how to address that. Um, One thing I'd say is, where you can do this, when you're out trick or treating, try to stay within a unit of your own family. Gathering up all the kids on the block and going as one big group of friends, that sounds great. That's what we're used to doing, but you're gathering everybody up too much. You can go so again, stay within your own family unit. If you're going to be close to each other, walking in a group as you go door to door, you can meet up with friends and other families. Just stay some distance ahead of each other and behind each other, and how you can still see each other and communicate and have a good time, but watch the distance. Try to come up with a costume where you can still put your cloth mask over your costume. The mask, it's wearing a costume mask, they say that isn't really going to help much, not nearly as what a cloth mask can do. We're advising not to put on a cloth mask over your face and then a costume mask over that, because you can have some difficulty breathing from that. Don't put a mask on any child that's 2 or younger. Be very careful. We want to be cautious in the spread of this virus, but we don't want to do anything to harm a child, of course. So be careful with the masking. Make sure that your kids are breathing okay through them, and they're doing okay in that regard. When it comes to handing out candy and such, one thing I read was gathering up whatever treat you have, put it in little plastic baggies and that are clean, and you can lay them out on the porch for kids to come and grab. You can keep doing that in cycles so that you don't have to be handing back and grabbing food candy and putting it in a child's basket or bucket. You want to avoid transfer of germs. So any way that you can do that, where you're minimizing all the touching of candy and treats and stuff like that, that's a safer way of doing it.
And let's just remember, Doc is not a professional trick-or-treat expert, so any of this can only be considered. That's dangerous to put all that candy in a bag. If I was a child at the time, running up and around and picking it all up. So
yeah, just use a lot of common sense as a parent. It's just be careful with it. If you're not comfortable, you think you can't control the situation, then come with some activities at home. Family movie night, things like that.
So, Doc, do we know anything new about how the virus spreads or how to prevent it, other than what we've talked about, or since you were last on?
That's a good question. I know a lot of people have asked me about that, and there's been some reversals from CDC and all that, and over the course of this entire pandemic we've been involved in. But I'll tell you what things that are true. To try to clarify, let's talk about the facts. The masks, they work in spreading the virus. Incredibly important. I mentioned that respiratory droplets are the primary source of transmission. That's very true. Surfaces as well. Touching surfaces and others, touching that dirty surface, that causes spread. We talk about those who are at higher risk. The number, the 65 years old and all those medical conditions that I mentioned previously, those are very real. We see a very real trend in those folks who contract the illness are definitely more likely to sustain a severe form of the infection. So that's very real. And for those who have any of those conditions or over the age of 65, take note, be very careful. It can be very bad for you. Again, though, like I said before, very important to understand that if you are younger than 65 and don't have any medical conditions, you still can get a very serious form of the illness. So be very cautious that way. There's been some updates in medications, and what do you use? Decadron is a steroid that's found to be effective in those who have a low pulse ox. That is the percent of oxygen that is absorbed into the lungs and gets carried into the bloodstream. When that is found to be low, to a certain extent, the Decadron is found to be very helpful. There is remdesivir, the IV antiviral medication. There's some criteria regarding the patient's condition that really, when if met, there's been several studies that support that remdesivir is very effective in helping to reduce the course of illness, reduce the severity of illness, and in many cases can be attributed to, in part, saving lives.
So if people do feel those symptoms, they're feeling uncomfortable, and they want to get tested, do you have the number, Doc, that people can call?
Yep. So we have two ways of doing it here in town. We've got the Civic Center, and then there is the system process set up through the hospital. That one, the hospital-based testing process, there's a number to call first. When you call, they'll ask you a series of questions about your symptoms, and then any symptoms or any concern, they're going to set you up with an appointment to go in and get the nasal swab done, and then they'll let you know about the results of that. That number is again 833-576-3627. Again, 833-576-3627.
And then if you would like to get tested at the Civic, because of the overwhelming response, they're no longer taking walk-ins, and you can sign up online at lhi.care/COVID testing. That's lhi.care/COVID testing. So again, we want to keep people safe, and the second part that I discussed was keeping the economy going. And we want to really help our small business, our local businesses, and so forth. And when they're out supporting restaurants and bars, and we've heard, the concerns across the nation with restaurants and bars, we want those to stay open. We want to support those. What are the same precautions, or what are the precautions people can take? I assume it's the same thing. Make sure the restaurant employees are wearing masks. Make sure you're wearing a mask. Make sure you're washing your hands. The tables are being wiped. Anything else that comes to mind there?
No, I think that those who are running the bars and restaurants and such are doing a great job of adhering to what the state is mandating. As long as all those safeguards are in place and being practiced properly, then your risk is extremely low. Arrive with a mask on, watch it, don't touch anything, get right to your table. Make sure that you've got at minimum 6 feet from the closest party that could be next to you. Distance is everything, hand hygiene is everything, and then masking when you're not eating or drinking.
So our schools have been a popular topic. One thing that people, I'm not sure, realize is the city of LaPorte does not control the school system. The Dr. Leonard, you do not control the school system. But I see, according to many of the messages on our line now, that they will be going to 3 days a week next week because of the uptick in COVID. Kids that are online, kids that are going to school, thoughts, that's got to be a hard thing on parents, because kids are always on the move. They don't want to be by themselves. Any thoughts, again, that you'd recommend to those kids that are going to school, athletics, doing athletics or whatever, and hanging out with others? I know it's a tough time and probably hard for you to say, but I think they have to be responsible.
Yeah, it is tough. It's tough for parents with work. It's tough with the children and not being able to socialize and be part of the social institution of all that going to school includes. Athletics. This is one of the biggest topics when it comes to dealing with this pandemic and how that pushes against just the typical norms of living our lives and enjoying our lives. These are where we have to make hard decisions. When you see a wave coming through and it's looking like we're looking at that right now with these numbers that we have, it makes sense. If 3 days in school, a couple of days out, alternating like that, it just makes sense because you're reducing the amount of potential exposures. When in school, keeping that distance, and those teachers, hats off to all the teachers and administrators there to do what they can to keep especially the youngest ones from adhering to these precautions. You can imagine there's gonna be some scenarios where you fall into the cracks and there's a break in precautions being followed properly, and that's inevitable. So we're trying to minimize that reality. I think is a prudent thing to do. So having some moments where you're learning from home, it just makes a lot of common sense. Although it is extremely difficult to accept and to deal with, just remember that by doing this, you truly are saving lives. If we didn't do this and you opened up to a regular way of living again, the virus is going to spread like wildfire, and we are going to inundate the hospital systems everywhere. You're not going to be able to take care of all of the extremely sick folks. There's going to be a lot of mortality, a lot of morbidity A lot of super sad stories, and the last thing you ever want to be able to or have to see or have to deal with is having to make a decision on who gets a ventilator and who doesn't. Let's not get ourselves anywhere close to that situation and just keep doing what we've been talking about since way back when this whole thing started.
So you understand why the school's going to just 3 days a week versus 5 with the uptick that we've had.
Definitely understandable, and I commend him on that decision. Tough decision to make, but definitely the right thing to do from a pandemic mitigation standpoint.
I would agree. So as you mentioned, ventilators and so forth, how is the hospital equipped right now to handle this increase? Where is the hospital at, and do you have enough of that equipment to handle this pandemic?
Yeah, but at this point, the hospital is still doing very well. We have there is no concerns about supply of ventilators, about supply of personal protective equipment. We are extremely careful and monitoring closely the health of our colleagues, our staff, our nurses, our physicians, everyone. We're extremely meticulous in all the precautions that we need to take within the hospital to keep our colleagues and physicians, nurses safe, so they can keep practicing and caring for the patients that arrive. We have enough beds to be able to handle the current surges that we're dealing with, but there is going to be a breaking point. Us, like every other hospital system, we can get overwhelmed. It's happening in Wisconsin and all around. It seems to be these waves that are just hitting in certain areas, and my concern is that we're right on the cusp of that right here in town.
And that's the other thing, again, you mentioned, but you'd hate to have to bring a family member in the hospital and say, hey, because we're not doing things that are necessary to keep people safe, we have an overrun of the hospital and not enough equipment that you could be potentially turned away.
Yeah, we're not looking at that now, and I'm saying let's do everything right now so that we don't have to come remotely close to that situation. We're looking forward, very excited about our patient move day. We're moving to the new hospital this Saturday. It's a beautiful hospital, state-of-the-art equipment and patient care rooms, and the citizens of LaPorte are very fortunate to be able to have such a beautiful new hospital with all of the medical equipment and state-of-the-art equipment that's there and resources that are there to care for everyone. I'm very excited about what the hospital has to offer. The ER is larger. They mentioned the PPE supply and all of that is we're ready to go, and we can definitely care for all of our patients in our community. We just it's just prudent to say let's just be really careful and try to keep the numbers as low as possible so we can continue to provide excellent care.
Well, and I'd like to mention October 24th, a big day on the move, and I want to give special props to Ashley Dickinson, the CEO. I'm surprised if you pull her out of there. She's probably going to stay there. She has put all her blood, sweat, and tears into that hospital and making sure it is what it is today. And so special thanks to her as well.
Absolutely, yeah. She's done a great job, her and the whole administrative team and all the staff, everyone involved in getting what we need as far as resources go, designing the hospital the way we need it, getting all the resources there, like I talked about, the support from from corporate to supply it the way that it is. Just phenomenal job. I'm very excited about it.
So we've talked about, everything we need to continue to do, wear the mask, wash our hands, clean our desktop, everything, social distance or physical distance. And, those are important things to keep this in line. We've heard a lot about vaccines. Are they coming? Any not, or are they not? Any comments from your perspective on vaccines? How close, how far related?
So far, what I'm seeing right now, so we're expecting a low volume to be available by the end of 2020 is what the word on the street is when you're looking, researching this right now. There are 4 manufacturers that are developing 4 different vaccines right now. 3 of those are a 2-shot series. 1 is a 1-shot type of vaccination. They're still under investigation, going through their phases of study to make sure that they're all appropriate and safe and effective. So there's still a lot of work done. The government has a process that they're going through. They call it Operation Warp Speed. That's the Department of Health and Human Services with the Department of Defense working to develop and distribute a vaccination as soon as possible. So, like I said, 4 are in development. 3 of them include a series of 2 shots, and 1 is a 1 shot only. Still remains to be seen which of those are going to be safe and effective, how many they're going to deploy. They're going to try to get production out as fast as possible to immunize those who are in need in the general public as soon as possible. I anticipate that they're going to do a stepped version of how they vaccinate and who gets the available vaccination doses first. There is a process that the state has been talking about, our state is talking about and currently building. That's still a work in progress. There is what the CDC is doing, what they're thinking about it as well. Like I said, in coordination with the Department of Health and Human Services and Defense. So it's truly to comment on in what order this should be coming out, still up in the air. So I wouldn't want to, state anything that's not factual at this point.
Well, that's good to know. But in the meantime, wear your mask, wash your hands, physical distance, and wipe down your counters and so forth. Again, we want to keep people healthy and we want to keep the economy going, but keeping people safe is number one. So
I'd say one more thing, with we were talking about testing, we're talking about precautions. Flu season is upon us, and influenza symptoms are extremely similar to those of COVID. So number one, very important, get your flu vaccination this year. By doing so, you can reduce the chance of getting sick at all. If you were to get sick, it can reduce the severity of your illness, and it could prevent the need for you to have to be hospitalized potentially. So again, you're conserving or we're saving some hospital resources as well. So extremely important this year more than any. Get your flu vaccination. There's many different venues where you can go to get that done. You can call your physician's office. Many places here in town where you can go and get that done. So I would strongly advocate for getting a flu vaccination this year. Please add that on.
Absolutely. And Doc, so we did have one question. Goes to show you the government cannot protect you from the virus. You cannot do everything right, or you can do everything right and wear your mask and still get it. I mean, I don't think it's 100%, but still the percentages by doing your part help keep other people safe as well.
Yeah, that's it. You could do everything in your power to prevent contracting it yourself, but it's still not 100%. However, it's very well known that if you adhere to these precautions, far majority of the population is going to prevent the spread and prevent getting it yourself. And then you will keep that infectivity rate as low as possible. And that's what's going to save lives. That's what's going to get us through this. There is end in sight. The vaccination will come. That too, there is no silver bullet in this. It's a combination of everything. Vaccinations are important. Continued proper hand hygiene, distancing, masking, all of that is incredibly important. Keeping yourself otherwise healthy. It's a culmination of all of these things that's going to get us through this.
So here's a question. Should people who have health problems get tested even if you haven't been sick?
Well, I would advocate for high risk exposure, that's absolutely the case. You don't have to have symptoms to have contracted the disease. If you have been in or around if you've been in contact with or around someone who is infected, I'm talking neither person, one or the other is not wearing a mask, and you're within 6 feet of that person for approximately 15 minutes. I know that sounds like a formula, but that's the most common. That's what the CDC is discussing. If you are within 6 feet of someone, you or that other person are not wearing a mask, and that person was found to be COVID positive, that's a high risk exposure. And if you fall into that category, it would be appropriate, and it is recommended that you go in and get tested. Because if you become a asymptomatic carrier, now we're just perpetuating the problem, right? So it goes beyond surveillance testing. Surveillance is just population testing to see, what is the local numbers that we have and infectivity rates in our area. That's surveillance. Those are for folks that don't have any symptoms or any concern that they came in contact with anyone. That is very effective from a population health perspective to understand where we are as a community, but also high risk exposures are incredibly important to be tested if you fall into that category, because we need to know if you become aware that you're positive, Now you're going to do even more. You're going to be able to quarantine now, isolate yourself for all the duration that they say is appropriate, typically about 2 weeks. And the time of a positive test is the time that you need to begin to quarantine yourself and prevent the spread to others.
I've heard recently that our COVID unit is almost full. Is that a fair and true statement?
The hospital has the ability to flex up in the number of beds it has available for COVID patients. We had reserved 15 beds to be what we call a COVID unit to care for those patients. We have met maximum capacity. Those numbers change every day, but we have reached maximum capacity of the COVID unit. That's a separate step down from the ICU type level of a unit. There also is the intensive care unit. Within the ICU, there are segregated areas where ICU level patients that are COVID positive are treated as well. When we go above those numbers, when we hit greater than 15 on the regular unit, we have the ability to flex up and place patients in COVID safe rooms with the right equipment, the right nursing, the right PPE, and everything to continue to care for them. So it's just a matter of how we operate and how we mitigate and use our beds.
If there's a way to identify if the students being back in school could factor in with the increase for LaPorte County, obviously we want to make sure kids aren't rushing back to school if they test positive. They need to take the appropriate time and test negative before they're going back, correct?
Yeah, basically every school has its own process that they're following. The state, when you look at the Indiana State Department of Health, they will have their guidance on what schools should be doing to mitigate spread and to, as far as criteria, to be able to come back into the school system. But they're in there, locally though, the school system has its own, locally it'll have its own criteria and how it wants to manage this. Do you need a positive test or not? Do you just run a certain number of days, be it 10 to 14, and then come back? What I've seen is that among the different school systems in the area, they're slightly different in how they all operate. But that's up to the school system itself to decide.
So if you have it and you get over it, that doesn't mean you can let your guard down, correct? Because you can get COVID a second time.
Yeah, that's right too, unfortunately. So far, the studies and the retrospective reviews that they're doing on those who have been infected, not very certain that just getting it once renders you eternally immune. They're still doing a lot of studies on that, and there's some suggestion that you can at least be a carrier as well. Again, if I'm not meticulous with my hand hygiene, I can still transmit by touch. If I was to touch a product at the grocery store, let's say, that had some virus on it, and then I went and touched some other things, I could be spreading it that way. So I got to be very careful in that regard. But you're just getting it once doesn't render you permanently immune, nor does it render you not a spreader. So regardless of the fact that I had gone through it and I haven't, I'm extremely vigilant still to follow all the precautions to the T. Got the mask on all the time, wash my hands all the time. It's just doing it not only for yourself, because I could catch it again. I do it for the entire community. Still a lot of tests out on that. There's still so much we don't know about this virus. We're only, these several months into the whole thing, and we still have more to learn. But for now, it definitely is safest to say we're just not sure. You can get it again. Some case studies look like that can be the case. So in the meantime, we all need to be careful. We all need to follow the same precautions.
And it's a great place in LaPorte to be where you can stay active. You can go to all our parks, even with the weather. It's getting a little cooler, but still fine to get out. And you'd still recommend, hey, spend as much time with family as possible and use that time to bond and get out and about and enjoy our community.
Yeah, well said.
Amelia Lasky, just because everybody loves Dr. Leonard, just wanted to tell you that, hey, miss working with you. So some props there. But I think was that the last question? That was the last question. Doc, you went through a ton. We appreciate that. Hopefully in a couple weeks, we can have you back on for another update as we go into wintertime. Anything you want to leave the community with before we head out for the day?
I just say again, hats off to the entire community for all that you have been putting up with, all that you have been dealing with, and how hard you have been working to try to do the right thing. There isn't a soul that isn't exhausted with going through this at this point. But we don't have a choice. And now our numbers are going up. So we just keep doing what we've all been doing. Lean on each other here. I will tell you again, it's very real. I can firsthand attest to that. It's the end is in sight. Vaccination is coming, and there's more and more we're learning about this virus and what we can do to mitigate this in the meantime until it's completely a thing of the past, God willing. So hang in there. I think great job, City of LaPorte, with all you're doing.
And wear a piece of fabric, cross your mouth, keep other people safe, wash your hands, physical distance, and we will get through this together. And it will be okay. And I think you said it, but I want to reiterate, we will be okay. We will get through this together. And LaPorte, again, is a great place to deal with this because you have all the parks, all the outdoors that you can enjoy as a family. So take advantage of that. One question just came in. What if, and I'll handle this, Doc, what if you tell your employer that somebody in your household tested positive, but they make you come to work? I mean, I think really you need to talk to the health department at the county level and see who they would recommend you speaking to downstate to file any type of complaint like that. That's probably not up your alley, Doc. But again, do your part, keep safe, and we hope to see you in 2 weeks. Everybody else out there, continue to stay safe. And I want to remind you that next Wednesday at 6 p.m., we will have another AMA, Ask Me Anything, where we'll talk about the water and wastewater infrastructure plan. We have work to do that we can't kick the can down the road any longer. It's $100 million worth of infrastructure work to keep our water flowing, to keep our wastewater working. And we'll look forward to that live on Facebook at 6 o'clock. So, Doc, thank you for your time, and everybody have a great rest of the day. We are definitely LaPorte proud.